Hello everyone and welcome to today's mental health segment sponsored by Los Angeles County Department of Mental Health. Today we'll be discussing about domestic violence and mental health. We are board members of SAHARA, which is a domestic violence organization for the South Asian community. Dr. Arora, can you tell us how domestic violence can affect children's mental health?
So exposure to domestic violence for children can have very serious effects. Children need to be loved, they need to feel safe, and they need to have predictable environment. When all this is at risk in domestic violence environments, these children don't know what to expect. They get very confused, they don't know how to behave, they have problems with regulating their emotions. So often you will see that they have bedwetting issues or temper tantrums, acting out issues. They don't get help at the right time. Then it even goes into adulthood. You see that they have difficulties in their relationships, either mimicking the victim or the perpetrator. So it's very important to get help at the right time. Dr. Najeeb, can you talk about how domestic violence leads into different psychiatric problems?
This ongoing negative atmosphere in domestic violence situation can lead to serious conditions like depression. The victim starts having low self-esteem because they have already been abused and put down. They feel that they cannot do things right. Their anxiety goes up high because they don't know when the next time they're going to be put down, yelled at, or physically abused. So there is a heightened sense of alertness that can lead to stress hormone being secreted more and causing more damage to the victim. The most alarming symptoms occur when the victim becomes hopeless or helpless and they feel like they don't want to live anymore. Some of them end up trying to commit suicide. But at SAHARA, we have therapists who assess and meet the needs of these victims and help them to regain their self-esteem and help them to process the pain of their trauma. In SAHARA, we can help them regain their dignity and help them lead a better life. Sometimes these therapists can also refer them to psychiatrists. So what we do is evaluate them about their seriousness of their depression and anxiety and see if they need medication. And some of these medications can help regulate the dopamine, norepinephrine, and serotonin, which are calming chemicals for the brain. And this helps to improve their depression and anxiety, and they are motivated to improve their situation, and they hope for a better life ahead of them.
No matter what the situation is, we at SAHARA are here to help and heal families. So please call for help at 24-hour hotline for SAHARA and check out the website.
If you or someone you care about needs help, call the Los Angeles County Department of Mental Health 24/7 helpline at 1-800-854-7771. Your call is safe and confidential.